You have a choice to deliver naturally or a painless delivery. Hi mommy, your 9 months of journey is nearly getting over. You've gone through the beautiful journey of 9 months and now lots of excitement is there and a little bit of fear is also there as to how you will cope with the normal delivery or cesarean. We normally know two ways, either a painful normal delivery or a cesarean section. When you think about painless, you think about a cesarean. There is another way out, epidural anesthesia, that is painless delivery. You will have lots of doubts about that now. What is epidural? What is the procedure? What are the advantages? What are the disadvantages? Because everything has advantages and disadvantages. So today we will see how all this is working. Now what is painless delivery? Is it painless or is it pain-free? I would call it is pain-free delivery. So what we normally do is epidural anesthesia is given by anesthetist in your back and that gives you relief from the pain completely. And how it is working? You have contractions in your uterus and your cervix is dilating. Because of these contractions, you feel the pain. And now this pain sensation reaches your brain and that is how you can perceive pain. And this is happening via your spine. So in epidural anesthesia, anesthesia is given in the back, in that space, the epidural space. And this is the space which is there between the bone of the spine and the spinal cord. There, certain injections are given, certain medications are given so that your areas become numb and you don't feel the pain and very comfortably you go through labor. I'm sure you're curious to know the procedure. It is epidural anesthesia given in your lower back. So the anesthetists are experts in this. They will clean your lower back with different antiseptics and then they will give you a local anesthesia where they have to insert the catheter. After giving the local anesthesia, your skin will become numb and then a catheter is introduced after giving a spinal. And in that spinal needle, this catheter is very gently introduced into your epidural space and then the needle is gradually removed. You will not feel any pain and the catheter that is there is generally taped to your skin and through that the medicines are given. Either we give at intervals or we can give a continuous IV infusion also. Before going through this process, you are given an IV drip to maintain hydration. At least 1 to 2 liters of fluid is given to you in labor. So you lie down very comfortably, the pains are happening, but you can't feel the pain. So it is pretty comfortable. But in the end, you have to push when the doctor asks you to push. Now there are certain advantages of this and there are certain disadvantages. So what are the advantages? Because you're so relaxed and so comfortable, the stress hormones reduce considerably. And because of that, the feel-good factor is there. The delivery duration reduces considerably. Your BP is controlled, your pulse rate is controlled, your heart rate is controlled because that anxiety is not there, that panic is not there. And by any chance, if this procedure has to be converted into a C-section, it is very, very easy. And it also prevents the pelvic muscles to be damaged. Now, there are certain disadvantages also. Some complications could be temporary and some complications could be very, very rare. So, the normal complications that we come across are some might have itching, some might feel nausea and vomiting because of the medication that is given, some might even have fever, the BP reduces, your bladder control is lost, that is why we catheterize you, you might have backache, you might have headache. And in the rarest of rare cases, sometimes the blood pressure falls so much, but because you are in the hospital, your BP gets managed nicely. And because you don't push, you don't feel the pain. That is why in these cases, instrumental delivery Normally vacuum is used more, and in spite of all this, sometimes there could be more complications and you might even land up in a cesarean. So these are the side effects of this. In rare cases, you might even have infections and nerve issues even later on. So now it is your choice. What do you want to have? A normal, perfect delivery? The nature has been delivering us like that since centuries. And for the coming so many years, that is not going to change. The delivery is something so pleasurable. It is just a state of mind. So if you want to go through a natural delivery, you can do that. If you want an epidural anesthesia, please talk to your doctor beforehand, because it can't be given right in the beginning. It is given only when you are at least 4 to 5 centimeters dilated. There are certain conditions when you cannot take epidural anesthesia. Some of them are if your cervix is less than 4 centimeters dilated, if your platelet count is low, and if you are on blood thinners, if you have any blood infection, and if the contractions are happening too fast, the anesthetist doesn't get time to insert the catheter, and sometimes the anesthetist is also not available. So these are the conditions which can prevent epidural anesthesia. Have trust on your doctor completely. Whatever the doctor is going to do for you, advise for you, will be the best for you. To remain stress-free and happy, download our iMumz app right now. Thank you and namaste.